Now we're going to get ready for our next session, which is really focused on everything to do with skin and med spa and estheticians. So it's called Beyond the Mirror, AI's role in the future of skin health and aesthetic treatments. And I'm happy to welcome to the stage Ian Michael Crum, who's a celebrity esthetician. Ian, please come on. We have Dr. K, who's also a facial plastic surgeon and the creator of Dr. K. Hello. And Evelina Aosa, who's the general manager of Topical Skin. Welcome.
Hello, everyone. Thank you for being here. Hopefully everyone has their caffeine fix. It's been a long day and we're excited. So let's jump right in. I'm an esthetician and I'm so excited that we're talking all things skin AI. So Dr. K. Durasia, you're widely known as an amazing facial plastic surgeon, an educator, thought leader in the aesthetic space. Let's kick it off. Tell us a bit about your journey. What first inspired you to pursue this field, and how has your role evolved over the years?
Hi, everybody. Thanks for having us. I'm so excited to work with Perfect Corp and tell you about my experience. So I'm a facial plastic surgeon. I do a lot with faces, surgery, as well as aesthetic treatments. I have a skincare line. I teach injectors from all around the world how to do injectables as well. And I'm a huge proponent of bringing the best and latest modern technology to our practice. So I started 20 years ago. I've had 20 years of machine learning faces the hard way. And now I have 4 kids. I have a skincare line, a podcast called Beauty Bites, Secrets of a Plastic Surgeon. It has like 1.9 million downloads, so listen in if you want to know my secrets. And yeah, I'm on Instagram at Beauty by Dr. K. Check out our platform. But the most exciting things I'm doing are kind of at the scientific level of doing 3D scanning of faces, understanding how facial volumes change as we age, especially in this day and age of GLP-1 shots, how everyone's getting facial wasting and Ozempic face changes. Like, there's so much we need to do to assess facial aging and help prevent it. I really believe in collagen stimulators and using the most amazing skincare. It starts with doing a facial analysis first.
Amazing, thank you. Evelina, could you tell us a bit about your role as general manager of Topical Skin, and how did you start in this journey in the skincare industry?
Sure, thank you for having me. I have been in the beauty industry, specifically in a professional grade, medical grade skincare for over 15 years. I've worked for the big beauty, for the who is who in private label of skincare for physicians. I have also privilege of incubating brands for a living, for Sephora, for private investors. And eventually I decided to have my own skincare line because there's so many ideas in my head and on paper. Not everything could be commercialized when you're working for the big beauty who wants to launch products that are applicable for 50, 60, 70 other markets. And that's how Topical Skin was born. I'm a general manager. By default, I call myself a general manager because I don't want to, take on a CEO title. I have, want to respect the real CEOs that have been in the industry for 20, 30 years. But I'm a founder, self-founded brand. And we try to merge the dermatological beauty, cosmeceutical science, biotech with natural ingredients, traditional Chinese medicine, Ayurveda, Eastern European medicine, so bridging the 2 worlds of beauty between clean and dermaceuticals, and that's what Topical Skin is.
Thank you for the background. Okay, let's jump into the AI piece. So Dr. K, from your perspective as a surgeon, how has AI really started to shape your consultations with patients or even planning treatments for your practice?
Well, Ian, I prepared a little video for you guys. Shall we show the video?
Let's cue the video.
Let's cue the video. So you've met me in person. Here's my avatar. And
where innovation meets elegance. I'm so excited to share the future of beauty and style with you today.
okay, this is how we do facial scanning the hard way with bulky equipment, very expensive. We get these high-resolution images, which now we're going to be able to do with Perfect Corp, where we scan the face and we can see facial volume change, We can now, with an AI app on the phone, scan this space. In 7 seconds, I get 14 different parameters of skin health, which really helps before and after treatments. And this is the aesthetic simulator. Patient showing me how she wants her lips to look. How big is the Cupid's bow? Here's her before. It's so much easier to deliver the results the patient wants when she can show me. This is Hairmetrics, which is AI for hair scanning, looking at hair follicle length, distance between follicles, follicle thickness, and miniaturization, giving patients a hair health index. And lastly, we have the ability to do skin print technology, where we take either a swab from the inside of the mouth or from the skin. This is our marketing campaign of my new skin longevity line using Canva, and it's very easy to upload images and do text to video in a simple way using Midjourney, Runway, or some of the other things. This is an actual line, and we have an artificial receptionist. Will AI replace my staff? I don't think so, but we've tried an AI receptionist on the phone in the office, and it is actually quite amazing. So I'm using AI in all different aspects of the business, from social media marketing, creating content, as well as using it for skin analysis. I think that's the really critical thing, is bringing a high-touch, high-level experience to the patient, so they can see that we're really elevated and different from other practices out there by doing all of this modern technology.
I think having any data points around skin and like, is this product working, that's so validating to the consumer.
It's so nice to do a before scan and then make a skincare recommendation. It's increased our skincare sales by 20 to 30%. Patients like that validated image. They like the skin score that they get because they want to compete against themselves and get better, so then you can show them on their follow-up how much better they got. And then we're also doing this kind of before microneedling, before laser, so you can show changes in pigmentation, redness, pore size, and all the skin quality measures.
Amazing. Evelina, so topical skin, you're known for pushing innovation with ingredients. How are you starting to see AI change the way that brands develop or even recommend products?
Sure. Well, medical grade or professional grade skincare is known for its precision and also efficacy. It's all about results-driven formulations. And you can only create, precision and result-driven formulation when you rely on specifically curated ingredients, active ingredients, biotech, at levels that are efficacious levels, at percentages that are also studied and clinically proven, at synergies of ingredients and also delivery system. There is a plethora of ingredients that we can shop. Thousands and thousands of ingredients. Because we are not big beauty with tremendous budgets and R&D hubs all over the world like L'Oreal or Estée Lauder, we rely heavily on AI to actually analyze the large data sets to put forward ingredients that maybe didn't come up in the research. I personally love to read articles in PubMed and see which ingredients have been validated clinically for their efficacy. But there's only 24 hours in a day, and I have to sleep, and I have to eat, and I also have to work. So with the help of AI, I'm able to actually pull information forward, and I'm actually finding new indications for ingredients that normally I wouldn't even be aware of. Like, we all know about vitamin C being a collagen cofactor, but it's also an antioxidant. It's also a brightening agent, and depending on what kind of formulation you are developing, AI can help put this ingredient maybe on the forefront that wasn't on your radar before. So for us, again, it's all about agility and speed to market. Like I said, we do have cosmetic chemists that are employed and work for topical skin. However, we don't have the plethora of resources of big beauty, so that's where AI comes in handy. They will do the due diligence, and then I can run the data by my lead chemist, and then we can either walk away from ingredients that don't make any sense, or we can prototype with some as well. So the speed to market is very interesting. And when I was preparing for this presentation, I actually went on PubMed and I figured, let me just search for AI and skincare. And I was completely flabbergasted to realize that there's an article in a peer-reviewed journal that has skincare and AI as a topic together. So AI is definitely here to stay, not only in beauty, but also in medical grade skincare. So I challenge you guys all to look at it. It's actually been published in April of this year, so it's very, very relevant. And beyond product development, I would also say we utilize AI for product recommendation. We actually got a preview of it earlier today during the Perfect Corp's presentation, which I wasn't aware of. But we know when it comes to search engine and the way people and consumers shop and research information, I think Google used to be the search engine, default search engine that we always, would rely on. Then social media came in, TikToks of the world, Instagram of the world. This is how people search for products, recommendations. Now we are learning that it's also AI, so the chat GPTs of the world. People are going on chat GPT and asking for product recommendations. So this chat GPTs and AI is becoming almost, in my eye, like a digital influencer, right? Because they do spit out product recommendations. Mm-hmm. So as a brand, I have to take into consideration that perhaps I need to invest into a platform where I should be visible as a brand. So for me, I think this is how the AI is helping with the brand, especially indie brand.
That's so interesting you say that. I had, for the first time, a patient come sit in my chair and I said, "How did you find us?" She said ChatGPT, and actually, so ChatGPT searched for facial plastic surgeon in Los Angeles. It came up with Beauty by Dr. K. She uploaded her image into ChatGPT and said, based on Dr. K's social media, what do you think she'd recommend and do for my face? And it actually gave her a morphed picture of what I would do, which is I gave her cheekbones, jawline. She didn't tell me this till the end of the visit, by the way. And then she pulls out her ChatGPT version. She's like looking in the mirror like, oh my God, it was so accurate. And it was so freaking accurate. It predicted I'd do jawline, cheeks, and like just kind of really fascinating what AI is capable of doing.
So it totally mirrored your kind of facial aesthetic that you show on your social.
Exactly.
That's wild.
We have to be omnipresent. We have to be on social media. We have to be on ChatGPTs of the world nowadays. And
so Evelina, you talked a lot about kind of these different opportunities with how AI is speeding up research and what ingredients should you use. Are there any challenges that you see kind of being faced, whether it's with consumer education or with this product recommendation, or even surgeon or dermatological partnerships, Dr. K?
I would say I see a lot of opportunities, especially on the brand side. The only challenge I feel like, the chat GPT or AI will never replace a skilled physician, plastic surgeon, dermatologist. It will be a tool in their practice and maybe it will help bridge the conversation between a patient and help visualize things, but I feel like that's the only challenge. Other than that, I feel like chat GPT, AI, it's all about opportunities. As a brand personally, I might be biased, but in clinical skincare, medical grade skincare, we are all about clinical data and efficacy. So let's say if I'm trying to communicate to a point to a consumer that this product improves the appearance of fine lines and wrinkles by 5% at the end of like 90-day consumer trial or clinical trial, it is hard for average person to visualize how it's going to affect their skin. With ChatGPT and AI, you can actually visualize what it means. People can upload their photo and realize that if they go on this product for 3-month time period, this is how their complexion will improve. And over time, this is how it's going to look. So I feel like ChatGPT helps to maybe like make the science behind skincare more consumable and more like relevant and relatable to average consumer. So I would say that's huge.
It's an exciting time for sure. Dr. K, I know you have already shared some of these interactions with patients and projecting how your clients could look, whether they did it themselves or with all the AI you're implementing already in practice. Is there anything else that excites you about all these different ways that you are kind of plugging AI into whether the skin scanning tech or I know you mentioned the AI as potential receptionist. Is there any other things that kind of you see on the forefront that you're looking at? In the beginning of that video, you guys met my digital avatar, which a year ago was much more robotic, and this year I think she's pretty elevated, but next year she's going to be amazing and undetectable. And so that's another way of communicating with patients. Like I can upload my entire database of 600 podcasts and me talking, and that avatar is going to be able to approach a patient and have this data bank of answers, everything anyone wanted to know very realistically. I still feel that there's so much importance given to the patient-physician relationship. Like in the past, I would do a rhinoplasty on someone and I would just do a consult, right? You can sit in my chair, I'll tell you what I think I can do for your nose, and you just trust me that it's gonna turn out great and look that way based on what you said, what I said. Well, now there's much more accuracy where the patient can actually do a little face tuning of an image and use an aesthetic simulator like the Perfect Corp one and show me what they want.
And then I can say, no, that's not realistic. I can't surgically guarantee that. So we can tweak things together and the communication becomes next level. So, but I think also in medicine, I feel like I'm protected. I have these skills that no computer will replace, no AI can replace. On the other hand, I think like everything you said about so much skincare information available at the touch of a fingertip, but patients and consumers also just buy based on trust, and likability, and all these factors of popularity, trendiness. We have to figure that into the equation even more than ever now that there's so much data overwhelm.
But I think it's a lot about perception as well, because consumers are so tech savvy. They expect from the brands to provide some kind of an experience, maybe
Yes.
digital, AI driven. So if you are not doing so, you might be perceived as kind of, an outdated dinosaur in a
Yeah.
sense. So I feel like you have to jump on the wagon because that's your competitive edge. Everybody else is doing it. It's kind of a norm nowadays. It's mainstream, and it's definitely here to stay. And I think I also have a little video, if we can play it, because I wanted to speak to an example of utilizing AI for visual image processing. And I know that indie brands are not the only ones who are taking advantage of AI image generator. I know that even Prada, the luxury house of fashion and beauty, is doing the same. They actually just launched an entire social media campaign based on AI imagery around Prada, which was kind of mind-blowing because I figured with their budgets and their creative director talent, it wouldn't be a case. But for us at Topical Skin, I can quickly walk you through a forest somewhere in Eastern Europe and tell you this is where we are sourcing our chaga mushroom, source of kojic acid in our eye cream, and you can visually get immersed into this journey. And some people resonate better with images versus written or spoken word. So I feel like with AI, it helps create this visual identity for the brand on a shoestring budget and on a quick time turnaround. And if you're working with retailers who might be running a campaign and they need a visual, specific to a brief, instead of trying to, scope up the work with multiple videographers, photographers, and make things happen, you can just tap into the power of AI. And these are the images created with AI. Obviously, they're not perfect, but this is what I can do at the comfort of my own home without hiring a creative director, without waiting months for prototypes and perfection of imagery.
So you're really using AI to help with all your creative in your ad campaigns, et cetera, as well?
Right. I think it's all about scale. And like I said, human capital, we have, we're on a shoestring budget just right now because we are still self-funded. So whenever we can use AI, we do so. We do have professional videographers and photographers on staff, but we can only produce that much content. And then in order to scale and produce, additional content and be more creative, we do tap into AI, power of AI.
And we've been using AI too for our skincare. Kind of the images that you saw at the end there are brand new launch, and really it's quite easy to take high quality images, upload them, and create any kind of background and make a video from a still photo. And so if you haven't tried it, it's very important. I think the difficulty in AI is there's so much AI out there and you want to use it, but no one really takes the time to sit down, download it, learn it, and try it for a full, try 3 hours of it and see what you can really do with it.
So with all these recommendations, I know the one you gave the example of the patient uploading her photo, being simulated, and also just with ChatGPT being able to give product recommendations. Do you see any good synergies between AI fueling these at-home treatments and in-office treatments and how they complement each other? And then any negatives around that as to are there people coming into your practice or engaging with your skincare brand where they've been told basically the counter opposite of what you want to tell them and you have to kind of counter that?
No, I see all positives actually. I loved what Angelica from Shiseido was saying earlier, that someday you'll be able to make your own AI template of your own skin. So understanding how your skin reacts, you'll be able to upload a set of ingredients from a new skincare you want to try and have your AI predict whether or not this product will be right for your skin. And I love the idea that Perfect You is patient-facing already, because I can